Hello, everyone, and welcome to today's enlightening discussion on a crucial guardian of our gut health, known as the mucin layer, which is known also as our Mucosal-Guardian. We'll delve into this fascinating physiology of mucin synthesis and mucin production and its pivotal role in maintaining a healthy gut. So, as we know, mucin is a complex glycoprotein, and it forms a protective barrier within our gastrointestinal tract, shielding us from harm and playing a key role in digestion. But this intricate guardian isn't invincible. And so today we're going to be exploring how this delicate balance of mucin can be disrupted by the microbiome when we have dysbiosis, by certain pathogenic bacteria, and as well how certain toxins and herbicides can also disrupt this very delicate layer. So let me go ahead and welcome you to this presentation. My name is Dr. Eduardo Beltran. I'm an internist, dermatologist. I work within the field of integrative functional medicine and treat autoimmune diseases. And once again, we'd like to go ahead and thank you for those who are watching this presentation. Please give it a thumbs up and share, okay? So let's go ahead and unravel the secrets of mucin and understand how we can nurture this guardian, this extreme important guardian for our overall well-being, okay? So let's go ahead and begin. This is the Mucosal-Guardian, unveiling mucin's exquisite function as a protective barrier in the gastrointestinal tract. So in this slide over here, we can see a image of the gastrointestinal lining, or we have the enterocytes, and these cells, as we can see right over here, are our famous goblet cells. Now, as we know, goblet cells are responsible for making mucin, and we have different types of mucins in the gastrointestinal lining, and we'll talk about that in just a little bit. So what's really important to know is that this cell right over here, which is a goblet cell, here we can see it's got its nucleus, it has its rough endoplasmic reticulum, its Golgi apparatus, it's got a series of vesicles that's where the mucin is going to be formed, and it has a small microvilli as well, okay? But this goblet cell, its main function is to make exactly mucin, all right? And there are different mechanisms by which this mucin is produced. And one of those mechanisms obviously is going to be through mechanical stimulation, where all of those peristaltic movements can enhance and stimulate the production of mucin. And also shear stress, whenever you have anything that's touching the surface of the inner lining of the gut and is producing any form of shear stress or movement within the gut, also stimulates that, and it's actually a mechanical form of stimulation, so that goblet cell will start producing and releasing those mucin proteins that it makes. Now, there are also inflammatory mediators that can enhance the production of mucin, and here we can talk about one form of cytokine known as interleukin-13, which is an inflammatory mediator made by certain immune cells. And whenever there's inflammation, this interleukin-13 is going to act upon a mucin gene, and it's going to express this gene so it can start upregulating the production of mucin. So whenever you have inflammation, and also prostaglandins, such as prostaglandin E1, E2, prostaglandin D2, prostaglandin F2 alpha, and prostacyclin as well, these are substances that are made through our immune system and some other specialized cells as well. But it's important to recognize that whenever you have any type of inflammatory process, usually coming from our immune system, it's going to start triggering the production of certain cytokines and prostaglandins that's going to start stimulating the production of mucin on behalf of these goblet cells. Now, we also have chemical signals and bacterial products that also stimulate the production of mucin. And here we can talk about a metabolite that's made by fermentation, also known as small chain fatty acids, that are made by many different types of bacteria that we have in our gut, right? And one of the major we have three major forms of small chain fatty acids here. We have butyrate, acetate, and propionate. Lactobacillus and bifidobacterium, these are bacteria that are part of our normal microbiota. And whenever we have an adequate diet, that is rich in fiber, obviously this fiber is going to be converted into a small chain fatty acid such as butyrate, acetate, and propionate. And this is a food energy source for goblet cells in order for them to be able to synthesize and produce their mucin. All right. Now there are also microbial antigens and lipopolysaccharides. And interestingly, whenever we have exposure to these toxins, endotoxins, or any of these microbial antigens, these goblet cells start producing mucin as a protective mechanism. So there isn't too much interaction between the microbiota with the immune system. All right, and we'll dive into that in just a little bit. So we also have some microbial-derived proteins, and here we can mention the bacteriocins, bacterial cell surface proteins, OVMs, outer membrane vesicles, and exopolysaccharides. These are just different types of microbial-derived proteins that come and also stimulate the production of mucin production, all right? Then we have other regulatory factors such as neuroendocrine signals, such as neurotransmitters and neuropeptides. Hormones such as cholecystokinin and gastrin can stimulate also the production of mucin on behalf of the goblet cells, and also vitamins and minerals such as vitamin A, vitamin D, C, zinc. Zinc is a very important cofactor for the production of mucin. Selenium, iron, and also magnesium. So we have specific vitamins and minerals that are very important for the production of mucin. All right. Now, when we look at the mucus layer of the small intestine, it's important to recognize that this mucus layer is divided into two different layers. We have an inner layer, also known as the inner mucus layer, that is in direct contact with the enterocytes, right? The inner lining. Now, it has a series of characteristics, okay? So first thing you have to know is that it's made up by a type of protein known as MUC2 mucin, all right? So, and it gives this layer a gel-like dense aspect, and it's a highly glycosylated, which makes it gives it exactly that jello-like dense layer, right? And one of the reasons why it's like that is because it acts as you know, as a area which is going to basically trap bacteria, and it's going to immobilize bacteria so it doesn't keep on, you know, invading the enterocyte lining, and it won't continue to interact with the immune system. So it has a function as a protective barrier from harmful substances, okay? And as I just mentioned, it's in direct contact with the enterocytes. Now we have an outer mucus layer that obviously it's also made by MUC2 mucin, but this is a little bit different. This is more loosely structured layer. It's less glycosylated, and it's easier to be able to move around and displace, all right? And this is very important because it's important to remember that this mucus layer is constantly being over and over recycled, and it has to, because if it doesn't, then we start getting into trouble. I mean, a lot of things can happen, okay? It acts as a habitat for the bacteria, so this is actually where you can find your microbiome, okay? Right? And it's continuously being replenished and renewed, all right? And actually, there's a bacteria that's very important in renewing and recycling in the whole turnover of this mucin layer, okay? And here we have it. It's called Akkermansia muciphylla, okay? So Akkermansia muciphylla, or muciphylla, whatever you want to go ahead and pronounce it, you know, this is a very important bacteria that is part of our normal flora, part of our normal microbiota, and it is a crucial player in the renewal and recycling of this mucin layer, all right? So one of the things it does is that it actually uses mucin as an energy source. So this is why it colonizes the mucin layer, right? And it has a series of enzymes which degrades mucin, and one of those enzymes is known as glycoside hydrosylases and let me go ahead and see if sialidases. There we go. So these are very important enzymes because they release simple sugars to be able to form energy, all right, for that bacteria. And on the other hand, Akkermansia muciphylla also makes acetate, propionate, and butyrate as well, okay? And there's a constant turnover helping in the recycling of both both mucin layers, the inner mucus layer and the outer mucus layer. All right. Okay, so this is something very important, okay? And when we have dysbiosis, sometimes one of the things that we're going to be able to see on a GI map is that these patients who have autoimmune diseases have a lack of Akkermansia mucophylla, okay? Or on the contrary, actually, you can have too much of Akkermansia mucophylla. And if you have too much of this Akkermansia mucophylla, now you have an exaggerated turnover, which basically is not allowing for that mucus layer to be replenished completely because you're actively, consuming it, because you have a overgrowth of Akkermansia mucophylla. So it's very important to note this is that Akkermansia mucophylla needs to be in a state of equilibrium, okay? And whenever you have dysbiosis, usually it can lead to a deficiency of Akkermansia or an overgrowth as well, okay? So let us go ahead and talk a little bit about now the fiber-mucin tight junction and the relationship that this has also with vitamin D, okay? Because vitamin D is a hormone that we make when we are exposed to the sun, and it actually has a very important function when it acts upon the tight junctions, okay? So we know that whenever we are in ideal conditions and we have a very, balanced diet when we're consuming fiber, we know that the bifidobacterium that exists in our gut uses that fiber to be able to feed itself and make what we know as small chain fatty acids that we just mentioned, like butyrate, propionate, acetate, whatever, right? So these small chain fatty acids are a food source for these goblet cells. And these goblet cells are the ones that are going to be making mucin, as we just mentioned right now, right? Okay. Now, it's important to recognize that this mucin layer is what separates, the microbiome from interacting with your immune system, right? So whenever you have a deficiency in the production of mucin layer, now we start getting this thinning out of this layer that allows for interaction between the microbiome with your immune system. And we don't want to be having that because that can actually induce autoimmunity down the road. And vitamin D is really important because when we have adequate levels of vitamin D, we actually downregulate and we make these tight junctions nice and tight, which these tight junctions have a main goal is to basically bind both enterocytes and keep the integrity of the gut lining intact, So vitamin D calcitrol has the function of protecting these tight junctions by inhibiting the production of zonulin, okay? So having good levels of vitamin D is very important in order to have normal tight junctions, okay? So here we have our tight junctions that are represented by the occludins and claudins. Now, this is a very common finding in patients who have leaky gut syndrome, okay? Usually patients who have leaky gut syndrome are being exposed to a series of substances that are inflammatory, such as gluten is a very inflammatory molecule. Gluten is made out of is a lectin. It's made up of gliadin and glutenin, and we know that gliadin upregulates the production of zonulin. And actually, that's one of the biomarkers that you find on a GI map is zonulin. If when zonulin is elevated, it's because you're making excessive amounts of zonulin because you're probably being exposed to something that's stimulating it. And one of the things that can stimulate zonulin production is gliadin. Okay, so whenever you have excess production of zonulin, these tight junctions can become loose, and now there's an increase in the permeability of the gut, okay? But not only that, now, besides that, a lot of these foods, a lot of these cereals that we're consuming, a lot of this wheat fiber that comes from our diet, it's contaminated with glyphosate, And glyphosate has a patent as an antibiotic back in 1996, all right? And it's a very potent toxin as well because it can actually destroy and rupture these enterocytes and break down these tight junctions, increasing permeability of the gut. And not only that, but also kills the bacteria. Since it's an antibiotic, it also kills the good bacteria that you have in your gut, such as bifidobacterium in this case. And if you don't have bifidobacterium in adequate amounts, Well, you're not going to be making these small chain fatty acids, and now these goblet cells are not going to have a food source to be able to make adequate amounts of mucin, and then this leads to thinning of this mucin layer, which is supposed to be protective because we don't want interaction with the mucus, with your microbiome interacting with your immune system, such as in this case. So as you can see here, there is no direct contact between this bacteria and this immune cell, which is the macrophage or a dendritic cell. But here now, since we have a thinning of this mucin layer, all of a sudden now we have interaction between the microbiome with your immune system. And this eventually is going to trigger a series of events such as overwhelming your immunologic tolerance, and eventually you end up causing what we call molecular mimicry, and that sets the stage for autoimmunity. Okay, so this loosening of these tight junctions, whenever you have low levels of vitamin D, unfortunately, you're going to be more prone to autoimmunity. This is why it's important to give vitamin D in adequate doses, not, recommended daily allowances. I mean, you really need to make sure that you're giving adequate amounts of vitamin D to these patients because it really works upon these tight junctions, okay? And if you have already leaky gut syndrome, this is going to definitely set the stage for leaky brain syndrome, okay? And that's when you start getting all of those cognitive issues such as Alzheimer's, Parkinson's disease, ADHD, autism, etc., okay? I can go down that road as well, but today we're going to be just sticking to mucin, okay? So now let's go ahead and talk about a little bit about this bacteria known as Helicobacter pylori. We know that H. pylori is a type of bacteria that can colonize the stomach and the upper gastrointestinal tract. And this can lead to various gastrointestinal conditions such as gastritis, peptic ulcers, and in some cases even gastric cancer. It has been described in the medical literature that H. pylori can actually cause gastric cancer. That is something that is recognized. And we know that infections, if they persist long enough, they can actually be a reason for developing any type of cancer, okay? And not just in the stomach. So H. pylori infections can have a significant effect on the mucin layer, which is a critical component. It's a very important component of the gastrointestinal tract, providing protection and also facilitating various functions. And here is how H. pylori affects the mucin layer. So we get a colonization by Helicobacter pylori. This bacteria is going to start going ahead and making its enzymes such as mucinase and sialidase, which degrades mucin molecules. And also, it causes a thinning of the mucin layer at the level of the stomach and the duodenum. And eventually, it's going to cause a disruption of mucin production, which affects the replenishment and maintenance of mucin production. And eventually, we're going to get mucosal damage, more inflammation, causing gastritis, and which can eventually cause ulcers. This is going to cause an impairment in the mucosal healing, and this impairment of the mucosal healing has a vicious cycle which continues to damage and continues to produce more inflammation, causing gastritis and ulcers, and this can eventually lead to a bleeding ulcer or even inclusively causing gastric cancer. But H. pylori also has a series of toxins. And here we have the vacuolating cytotoxin A, also known as VAC-A, or cytotoxin-associated gene A toxin, also known as CAG-A, which damages gastric epithelial cells, disrupting cell signaling and causing tissue damage, which eventually can cause gastritis, ulcers, bleeding. All right, so now let's keep on going. Now we're going to be talking about the different types of mucin proteins, glycoproteins that we find in the stomach and the small intestine and also in the large intestine, the colon, okay? Now, the gastric mucus layer, the composition of the type of mucin that's primarily found in this region is a type of glycoprotein known as MUC5AC and MUC6, which are mucin glycoproteins secreted from these goblet cells. And obviously, this is the type of mucus that's found here is a more viscous and less permeable compared to the mucus that's found, for instance, in the small intestines and also in the large intestines. Okay, now what's interesting is that the turnover is very fast. I mean, in a lapse of 24 hours, these goblet cells are constantly making these mucin proteins, glycoproteins, at a very high rate. Okay, so the turnover is always about of approximately 24 hours. Okay, now the main function, obviously we know what the function is to give you a protective barrier against the acidic environment and also the proteolytic enzymes that are found also in the gastric juices. And it also helps prevent the autodigestion of the stomach lining. So it's very important for this mucus layer to be actively, renewing this mucin glycoprotein that you have. That makes up the gastric mucus layer. Now, when we look at the small intestine, basically, as we mentioned previously, the type of mucin glycoprotein that's made over here is called MUC2, which is secreted also by the goblet cells. Okay, and now if you look at the turnover, it takes about a week for this mucin layer to be able to renew again. Okay, in comparison to the gastric mucus layer, which is basically 24 hours. So you can see that they have a different metabolic rate, right? Now the function, as we know, basically we know that there's an inner layer and an outer layer. So this mucus layer separates what the microbiome separates the microbiome from interacting with the immune system, right? And it also, the outer layer also acts as a lubricant, aiding in the smooth passage of food and also protecting the epithelial lining. Don't forget that the inner lining of the inner mucus lining is a protective barrier that kind of traps bacteria and doesn't allow it to continue to invade the enterocyte lining, right? Because one of the things we do not want is to have that interaction of the microbiome directly interacting with your immune system, because that would foment what we know as autoimmunity, right? So that's basically the main functions that we have from the goblet cells that make mucin MUC2 glycoproteins. Okay, when we go now and look at the large intestine, the colon, here we have a different type of mucin, which is a combination of MUC2 with MUC5AC glycoproteins, which basically makes a more thicker adherent layer on the epithelial surface. And the turnover is even longer. It's about 2 weeks, all right? Around 15 days or so. So the mucus in the large intestine serves as a lubricant and also a protective barrier and acts as a habitat for the gut microbiota. Okay, and helps maintain gut homeostasis by preventing direct contact with the luminal contents of the epithelium. Now, let me reinstate something that's very important here. Let us not forget that basically 90% of your microbiome is located where? In your large intestine, okay? So whenever you have a cross-contamination of gut bacteria or gut microorganisms that colonize, the small intestine, right? Because of some issue that might be happening, for instance, in your ileocecal valve, or you might have some constipation issues and you start accumulating a lot of fecal matter in the large intestine. And then, eventually with time, this fecal matter can eventually cross-contaminate and pass over from the large intestine to the small intestine, allowing for these bacteria that are not supposed to be in the small intestine now to be able to proliferate, to grow, and colonize the small intestine. And this sets the stage for a condition known as SIBO, which basically means small intestinal bacterial overgrowth. And don't forget that the small intestine is the ideal place where you have all the nutrients, all the food, all of the good stuff there, so these bacteria can actually proliferate and start growing. That's the definition of SIBO, small intestinal bacterial overgrowth, right? And once you have SIBO in place, guess what? Autoimmunity just gets even worse. If you already had dysbiosis and now you have SIBO, things are going to get even worse. And a lot of the symptoms that usually patients have when they do complain about SIBO is they have a lot of constipation, they have a lot of issues with bloating, a lot of fermentation. Sometimes they might even have diarrhea. They might have some, abdominal pain. Well, the symptoms are going to be, a lot of irritable bowel syndrome or irritable bowel disease syndromes. Okay, alrighty. So now, what's the mucin turnover time lapse? Well, we said that the mucus layer in the stomach is about 24 hours, in the small intestine 1 week, and the large intestinal 2 weeks. But the determinants in order for this to take place, these are the time frames when everything is functioning and everything is normal. But when all of a sudden you have dysbiosis, these turnover weeks takes months in order for you to be able to heal. This is why whenever you go and you undergo an anti-inflammatory diet, you start taking a diet that is free of gluten, free of lactose, free of sugars, free of dairy, free of food maps, and sometimes you need to go even more, the low histamine. And in some instances, you even have to do the elemental diet in order to be able to kill off and die off those bad bacteria. And it takes around a good 90 to 100 days in order to get that benefit from the healing process. When there is dysbiosis, when there is SIBO, when there is SIFO, when there is the presence of a biofilm. This is why it takes longer, okay? But the mucin turnover determinants are going to be based on the type of diet, the general health state of a patient, the degree of dysbiosis, which is a very important aspect. Medications also can influence this too. Stress, genetics, and age. The older you get, the harder it gets too. So these are the determinants of mucin turnover, okay? Now let's go ahead and talk about the gastrointestinal cell types. So we know that the cells that are found in the stomachs are different from the ones that are found in the small intestine, and the ones that are found in the small intestines are different from the ones that are found in the colon, right? So the gastric cells, the surface mucus cells, these cells responsible for producing mucus in the stomach have a rapid turnover rate, which is approximately around 2 to 3 days, okay? Right? Now we're talking about the mucus cells. But the parietal cells and the chief cells, these take much more longer time, all right? These take weeks to months. This is the reason why healing of the gut takes a long time, all right? Especially of the stomach. Now the enterocytes, are represented. It's just one line of cells that are found in the small intestine, which have a very important function in the absorption of all the nutrients. This turnover rate for these cells are around about 3 to 6 days. All right. So this is a rapid turnover, which allows an efficient absorption of the nutrients, right? Now in the colon, in the large intestines, the turnover is around 4 to 7 days, okay? It's a little bit longer when in comparison to the enterocytes. The colonocytes take a little bit more, right? But, as I said, the cell turnover determinants are going to be based on the general health state of the patient, the type of diet that patient has, the degree of dysbiosis, if there is a disease present, the metabolic rate of that person. Let's say that person might have an autoimmune disease that affects his thyroid, for instance. They might have hypothyroidism, so that metabolic rate is going to be much slower. The environmental factors can also influence there too. People can be taking medications, right, like steroids or antidepressive drugs or antibiotics, right? Hormones also influence greatly here. Physical activity, genetics, and age once again. So as you can see, there are a lot of common things that can be shared between mucin turnover and cell turnover, right, as determinants. But what is basically going to be able to dictate the improvement in the cell turnover and mucin turnover is going to be basically the diet in a great percentage here, okay? Because diet is what is going to determine the degree of dysbiosis, or also the degree of diversity, the richness that that microbiota has, okay? And the clinical improvement usually takes about 90 to 100 days, because you have to think about it that the whole epithelial tract, the stomach, the small intestine, the colon, in order for it to start changing, you need to improve the bowel movements, you need to renew that epithelia, you need to renew that mucin layer, that mucus layer, and you need to also sometimes even treat with certain antibiotics, certain herbals, to be able to kill off and die off those bad bacteria. And sometimes you have even patients that don't have a gallbladder, where we know that the gallbladder is very important because it's a reservoir for bile. And when you do not have bile, well, you are setting the stage for dysbiosis, because bile by itself, not only does it help in the emulsification of fats in order to be able to facilitate absorption of these foods that have fats, but also it acts as an antibiotic by regulating, the bad bacteria that you have in your gut. So individuals who do not have a gallbladder are much more prone to developing digestive problems and also dysbiosis. Okay? All right? Okay, so you guys, well, thank you for watching this video. I hope you enjoyed it. And please make sure to subscribe if you've not subscribed. Give it a thumbs up and please share. Okay? My name is Dr. Eduardo Beltran. I'm an internist, dermatologist, integrative functional doctor, research scientist, vitamin D expert, and the creator of the LGS protocol. Please share this video if you know someone that might be needing a little bit of information in regards to autoimmunity. The mucin layer most definitely is a very big component of improving our general gut health. All right? So once again, thank you, and until next time, bye-bye.